Professor Dr. Spanish, English, French, Arabic,
German.
Yes, we will be there for you.
You go to the Grand Bazaar, you go to Taksim, you see that beautiful food, and then you shopping. Beautiful journey. Strong. Reach out to Iuliana.
To Lyly.
Please comment below and also like this video. Hi guys.
Hello,
Hello.
everyone. Welcome
To what? All about
health.
Yay!
I'm Iuliana, and today I'm here with my gorgeous colleague Lyly, and we will talk about
health.
health. Yes,
Kinda
about health.
a step by step.
All the process.
Yeah.
About the surgery, since
Yeah.
you get in contact with us till you go back home.
Perfect. Again, guys, today we are going to have a conversation. As you may know by the title, it's all about health, but it's going to be a little bit special because we are international patients coordinators. We are going to discuss about the steps when our patients reach out to us. They come here, they have the treatment done, especially bariatric surgeries. They stay here for some days and then they go back to their countries. So we're gonna talk about it with my beautiful and amazing colleague, Iuliana.
Thank you.
I got it. Okay. So we start from where they reach out to us.
Yes, you get in contact with us, then we get your information and we will see if you are suitable for this surgery. And after all the doctors agree, we can fix an appointment. If you want, you can have a video conversation, a video consultation with one of our doctors to be sure to ask your questions before coming.
Yeah.
And when you decide to come, you can book your flight tickets and we can organize everything with the hospital, with the hotel, with the transfer.
Yeah.
And of course, we will create a special group on WhatsApp.
True.
Where we share all the information, the meeting point, and everything will happen before and after the surgery. After the surgery, this group is very helpful because you can ask everything about your diet and you can ask your questions directly to the doctors.
Yeah, and also basically it's going to be like a, kind of like tracking, follow-up, kind of group. So you could have your medical team in there, you have also your dietitians team as well. So we will be there just as your coordinators at the end of the day. So that's that. And then our patient, they booked their flight.
Yes,
they came to Turkey and they've arrived and then they meet our transfer team at the airport, right?
Yes.
And then from there, they go to the hospital. And so at the hospital, so 1 day prior to surgery, if it's bypass or gastric surgery, I mean, those type of bariatric surgeries, the patients will have to do pre-operative tests. So 1 day prior to surgery. So basically, you will have all the medical information, again, as Iuliana said, through the WhatsApp group, basically. So when the treatment, the tests are done, basically, the next day, they are actually ready for the surgery.
Yes.
But before that, we have a lovely, beautiful thing that our doctors usually do every morning before all the surgeries, which is the visit
with our Professor Dr.
Yeah, basically, since our patients, they have done their tests before, right? So one patient will receive all the results. The doctor will make the evaluation and then let our patient know, okay, this is okay, everything is good, your health, everything is settled, you are ready for the treatment, and the treatment will be done at this time.
Yes.
And so then next what?
Next, we will pick you up from your room and go to the operation theater for the surgery. But before the surgery, we have to check your stomach to see the situation inside through endoscopy. If everything is okay, we will continue with the surgery. The surgery lasts about 45 to 60 minutes.
Yeah.
And then after you wake up, you will be back to your room.
Yeah. So if it's gastric sleeve, for instance, but if it's bypass, it's one and a half hour. True. And so I do have a question though, because would you share that? Because it would be great for a patient to know. All the coordinators, do they stay at the hospital from the beginning till the end of the surgery?
No, actually our medical team and our dietitians will be there at hospital with you. But sometimes for some situations we have to go and see our patients as well. Yeah. But don't worry, our team knows Spanish, English, French, Arabic, German, yes, Bulgarian as well.
Yeah.
But if you need anything, of course, we will be there for you.
Yeah, on WhatsApp always.
Yes.
And then the surgery is done, bypass, gastric sleeve, or any other bariatric surgery. The patient comes back to his or her room a little bit like 2, 3, 4 hours later when it's the last visit. by our doctors just to double check and let the patients know that the surgery went well. So they come for the second visit and then they give that information. And the thing is, few hours later, our patient is able to do the walking part, right? The first mobilization with the nurses at the hospital.
Yes.
Then the next day, the patient is still at the hospital, right?
Yes,
Like
yes.
the second day after the operation. So then what's next? What happened?
The third day, you will start your liquid diet.
Yeah.
Our dietitian will explain everything to you.
Yeah.
We will give you your protein shakes.
Yeah.
And then if everything is okay, if all the blood tests are okay, and if the doctors agree, and if you feel able,
Yeah.
you can go to the hotel. You can be discharged from the hospital.
Yeah.
And then you can relax and take your time to heal. Generally, my patients go for a walk to see the city. They go to Grand Bazaar. They go for shopping.
Yeah, they do, yeah.
But they don't eat. They cannot
Yeah,
eat
it's
anything.
unfortunately.
Yes.
That's the part. With the beautiful,
Yes.
I mean, the bad, beautiful food for our patients. Outside, you go to the Grand Bazaar, you go to Taksim, you see that beautiful food, and then you...
You just smell it.
Yeah, that's the only thing. But it's still a beautiful journey because at the end of the day, they have the ability to visit. Because some
Yes.
patients, they think that when they come here, they cannot actually do anything besides laying down
Yes.
right on the bed and just staying
Yeah.
at the hotel or like the hospital, which is kind of like not all the time the, you know, how it is. So some patients, as she says, they go out, they can visit, they can do some shopping, right? Shopping. And then, yeah, and so after that, so when the patient is discharged, you said, they
Yes.
go right to the hotel. So we usually have our last checkup, which is usually, it can be done one day before the patient goes back to his or her country. But usually our medical team, they organize the last checkup. But just be sure that before leaving the country, you always have to see the doctor and you will always have the, you know, the last checkup. And then the doctor will check again if everything is good with the health, the recovery process, also the diet, because you start with the first liquid diet. So our medical team and the dietitian team, they check that and then they see if everything goes well. And would you like to add something on that part for
Yes,
the last
actually,
checkup?
after the liquid diet, you will have 2 more diets.
Yeah.
And in the last check, our dietitians will explain to you everything you have to know about these 2 diets, pure diet and solid diet. Of course, if you have any questions, you will be in contact with us all the time. Even though you go back to your country, we will be here to help you. And of course, every 3 months, we need your blood tests, and every 6 months, your abdominal ultrasonography to see if everything goes well. And we are waiting for you back for another check. If you want to come to visit us, we will be here.
Yes. So that's it pretty much. And then the last day, which is your return day, you wait at the hotel for our transfer team to come pick you up, and then they will bring you to the airport.
And then you will be ready to start your new life, a new beginning.
Healthy way.
Yes.
Beautiful journey. Strong. So yeah, so if we can make like a summary about that. So first step, they reach out to us.
Yes.
And then second step, they
will be picked up from the airport and they will be brought to the hospital where we will start with all the medical investigations. And
third
then
step,
the visit with our doctor, the surgery.
Fourth step, basically when you can be able to be discharged and you also start your liquid diet. And then the fifth step, it's the last checkup. And then the last one is you are picked up from the hotel to the airport actually. So it's quite, of course, it's many things, more detailed, but we're just trying to give you summarize information. And of course, you can always reach out to us, reach out to Iuliana.
To Lyly. And
So,
one more thing, we didn't talk about how many days they have to come.
Oh, true. How many days do they
Yes,
have to? How many days?
1 week. Only 1 week.
Yeah, actually it's 7 nights, but it's 8 days because we do need you to come one day before the surgery. So that makes 8 days in Istanbul, but it's like 7 nights. So that's why we usually just say 1 week, to stay here in Istanbul. So that was that. It was not that long actually. Happy. Good, so that's that, and
we hope that this video is useful.
Yeah, we really do. And please, just if you have more questions, if you would like to know many things or more information about anything related to surgeries and our doctors, us, everything, please comment below and also like this video. Yeah, because it's good, right? And thank you for my beautiful colleague, because she, you know, she's here and we are able to do this. And thank you to you guys for watching us.
Yeah.
We'll see you next time.
See you here. Bye-bye.
Bye.